How are you doing today?
Good. How are you?
Good. We're going to do your annual physical exam here.
Okay.
We're going to start out with your vital signs today and take your temperature. Say off on it. .3, that's really good. Next, we're going to do your pulse here. Alright, very good. Got your pulse at 60 beats a minute and your respiration's at 12. Okay, very good. Alright, next we're going to take your blood pressure. Wrap this around your arm, might be a little tight. Okay, you can relax. I'm going to feel your pulse here and pump it up. Alright, I'm going to listen to you. Very good. I got 122 over 78. Okay. Good job. Alright. Now we're going to move into your whole body assessment. I'm going to first look at your skin here, look at your color, your temperature, make sure you're nice and warm, your vascularity, and I'm going to check your skin turgor here to make sure you're nice and hydrated. Next, I'm going to look at your nails for the color, the shape, for the capillary refill, press on for any lesions. I'm going to get you to put them together like this. It's called a Shamrock test. Make sure it's less than 160 and you're good. Okay, we're done with that. Now we're going to move into your head and face assessment. First off, I'm going to inspect your scalp and look in for any lesions or anything. At the same time, I'm going to look at your hair to check the luster, the texture, and the distribution of any excess. Looks good. Alright, now I'm going to palpate your skull for any bumps. Do you have any pain while I'm doing this? No. Alright, you can put your hair back up. Now I'm just going to inspect your face to make sure everything is symmetrical and in line. Look at your smile, and frown, and puffy cheeks. That's testing your cranial nerve number 7, which is your facial. Okay. Now I'm going to palpate your face here. Any pain while I'm doing this? Mm-hmm. I'm going to palpate your frontal and your maxillary sinuses. Any pain doing that? Mm-hmm. I'm going to palpate your TMJ and get you to clench your teeth. Good. That's testing cranial nerve number 5, which is your trigeminal. Okay. Okay, now we're going to move on to your neck. First off, I'm going to inspect your neck. Get you to swallow some water while I do that. That's great. I'm going to undo your gown so I can see everything a little bit better. Okay. I'm gonna first I'm gonna palpate your carotid arteries one at a time so I don't get you passing out. And then your temporal up here. Looks good. Okay. I'm gonna palpate your trachea to make sure it's midline of the neck. Good. Now I'm gonna give you this water back. I'm gonna ask you to put a little bit in your mouth and hold it until I tell you to swallow. Okay. You need to turn your head to one side. This way. Good. And then push your. You go. Swallow it. All right. Same thing other way. Good. All right. Now I'm going to palpate your lymph nodes. We got your preauricular here, postauricular here, occipital back behind your neck. I need you to turn this way. I'm going to look at your posterior cervical chain, your deep cervical chain, and then your anterior cervical chain. And this way, we have your posterior cervical chain, your deep cervical chain, and your anterior. And then you have your tonsillar here, your mandibular here, and submental here. You need you to shrug your shoulders. And you have your supraclavicular lymph nodes and your infraclavicular. Same time, maybe you shrug your shoulders against your hands. Good. Let's get your hand this way, forwards, and back. And that's testing your cranial nerve number 11, which is your accessory. Okay. Now I'm going to move into your ears. First off, I'm going to inspect your ears. Sorry. Inspect your ears to make sure that they're symmetrical and they line up with the outer canthus of your eye. I'm going to palpate your auricles and your crane and your tragus. And now I'm going to use the otoscope here just to look in your ear and look at your tympanic membrane. Okay, I'm going to pull up and back. And so looks good in this one. Let's look at this one. Pull up and back. And it is pearly gray, looks good. Okay. Now I'm going to do what's called the Weber and Rene test on you. I'm going to put this tuning fork on the top of your head and need you to tell me if it goes to both ears equally. Okay? Okay. Now we're going to do what's called the Rene test. I'm going to put the tuning fork back here in the master process, and you tell me when you stop feeling it. And then I'm going to put next to your ear and you tell me when you stop hearing it. Okay. This is testing bone and ear connection. Okay. Good, you're at 7 and 15. You do the same thing with that right here. Good, you're at 6 and 17 on that here. Okay, now we're going to do what's called the Romberg test. I'm going to get you to stand up and put your arms out to the side and lift leg one leg and close your eyes. Good. I'll do the same thing, the other one. Good. That was testing your cranial nerve number 8 is your vestibulocochlear. Okay, all right, you can sit back up. Next, we're going to move on to your nose. My gloves on here. First, I'm going to inspect your nose to make sure it's in the middle of your face, make sure everything's symmetrical. I'm going to get my pen light and I'm going to look to look at your turbinates and your septum to make sure your septum's not deviated. Okay, look up for me. Looks good. Looks good over there too. Okay, now I'm going to do check the patency of your nares. So I'll include this one. How do you guys smell? Good. Thank you. Good. Now we're going to do a smell test. So maybe to close your eyes and then you tell me what you think you're smelling. Okay. You do your this nostril first. Yes, it is vanilla. One more. Okay, that is your nose. Okay. Now we're going to move on to your mouth. I'm going to inspect your lips and palpate them for any cracks or sores, pain or anything. Okay, now I'm going to inspect your mouth. I'm going to get you to open up wide and say, ah, ah. Let me see if your breathing is rising. I'm going to look at your teeth, see if there's any missing in your gums. And I'm going to look for your Wharton and Stinson's ducts too on each side. And now I'm going to initiate your gag reflex by touching the back of your throat, but I'm not going to do it. And now I'm going to do the taste test. Okay. So I'm going to put something on your tongue, and I want you to tell me what you think you're tasting. Okay. I'm going to put it in a certain spot on your tongue, too. Okay. Sugar? Yes. Okay. Cinnamon? Yes. 2 more. Salt? Yes. Last one. Lemon juice? Mm-hmm. Alright, that's good. And that is your, one more. I'm going to have you stick out your tongue, move it side to side, up and down, and then press your tongue into my hand here. Mm-hmm. Good. That was testing your cranial nerve number 12, which is your hypoglossal. Okay. Alright, now we're going to move into your eyes. First, I'm going to get my Pinlet. I'm going to look at the external structures of your eyes from each side. This side. And straight on. I'm going to shine my light at the bridge of your nose, and I'm looking for the twinkle in your eye, and that's your corneal light reflex. Okay. I'm going to get you to look at your pupils. They are equal, round, they are reactive to light. I'm going to have you look at my finger and look at the object behind me and look back one more time. Good. As they accommodate. Now I'm going to do pull your conjunctiva down to inspect them. They're pink, moist, and good. We do an H test. I'm going to get you to follow my finger. Now this is testing your extraocular eye movement. Good. Okay, that's good. Now I'm going to do the cover-uncover test to test for any lazy eye. So I'm going to cover this eye. Shine a light in it. Okay. Good. Do this one. Good. No lazy eye. Now I'm going to do the direct and consensual. So I'm going to hold my hand in between your eyes and make sure that both pupils are going to contract when I shine a light. Here. Good. Do the other one. Very good. Okay. And then I'm going to do the Rosenbaum test. I'm going to hand you this and ask you to read the first 2 lines. And this is testing your cranial nerve number 2. This is your optic.
JK is a 16-year-old who has recently had an emergency appendectomy. He is brought up from recovery and is holding his abdomen saying, "Help me, please help me."
Very good. Okay. Now, one last test. I'm going to have you stand up, and we're going to test your peripheral vision. Okay. So stand kind of close together. Can you cover this eye for me? Mm-hmm. Now, tell me when you see my hand.
Okay. Now. 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 Now.
All right. Switch eyes. Here we go.
Now. 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 And now.
Very good. Okay. I'm going to sit back down. That, the Perla, the H test, and the visual fields test was testing your cranial nerve number 3, 4, and 6, and that was your oculomotor, your trochlear, and your abducens. Okay, next, after that, we're going to do your thorax and your lungs. Check those out. First, I'm going to, get you to stand back up. I'm going to pull your gown down. I'm going to inspect your abdomen to make sure your anterior, posterior is, this needs to be twice the length of your transverse this way. Okay, it looks good. Now I'm going to, I'm going to palpate your back here. Any tenderness or soreness here?
No pain or tenderness.
Okay. Now I'm going to do tactile thumb test. I'm going to put my hand here and have you say 99.
99.
Good. I'm just feeling for any vibrations. Make sure you don't have fluid in the lungs. Now I'm going to pinch together your skin here and push up. I'm going to have you breathe. And that's symmetrical expansion. There you go. Both your lungs expand at the same time. Okay. Now I'm going to state your normal lung sounds. So first from the front, you have your tracheal lung sounds, your bronchial, your bronchiovesicular, and then everything else is going to be vesicular. Okay. And then on the back, there's no tracheal, but you have bronchial, bronchiovesicular, and then vesicular here. So now I'm going to percuss your thorax to listen for normal lung sounds. And make sure to go back and forth so I can compare. Okay, that's good. Now I'm going to auscultate those sounds. Alright, I'm going to do the same thing again, but when you feel my stethoscope touch your back, I'm going to have you say 99. Or no, I'm going to say E, and this is the test called egophony.
Okay. E, 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 E.
Very good. That was normal because it sounded like E, but if it sounded like an A in my stethoscope, that would be abnormal. Okay. Alright, we're done with your lungs. I'm going to have you lay down flat on the table, and I'm going to look at your heart. Okay. First, I'm going to get down here at eye level and inspect your chest for any pulsations. I don't see any. Okay, and now I'm going to palpate your valve areas for any thrills. Now I'm going to locate all your valves and mark them with a piece of tape. So first I'm going to do, this is your aortic, and it is on your right sternal border, your second intercostal space. So feel for that. Next is your pulmonic, and it is going to be on your left sternal border, second intercostal space. And at these two spots, the S2 sound should be louder than the S1. Okay. Next, we have Erb's point, which is your left sternal border, third intercostal space. Okay. And that S1 and S2 are equal here. And then your fourth intercostal space, your left sternal border, is your tricuspid valve. And then down at the apex of your heart, at the fifth intercostal space, is your mitral valve. And here, the mitral and the tricuspid, S1 is louder than S2. So now I'm going to auscultate your heart sounds with the bell and the diaphragm, using the bell to listen for breathes. Okay. And when I was doing your neck exam, I forgot to auscultate with the Bellmeyer stethoscope your carotid, your thyroid, your temporal. So I'm going to go ahead and do that. Okay. Alright, sounds good. Last thing for your heart is I'm going to tell you what all your pulses are. Again, your temporal arteries are here, your carotids here. I'm going to feel for your radial pulse, your brachial pulse on this side as well. Your radial here, and your brachial. And then you have your femoral between your thighs. And then you have your pedis dorsalis on the top of your foot here. Feel this one over here. And then your posterior tibialis. Okay, good. All right, you can stay laying down. We're going to do your abdomen. I'm going to take this to first thing I'm going to do for your abdomen is I'm going to get down to eye level on your right side to see if there's any peristaltic waves and the abdomen is flat. Next thing I'm going to do is I'm going to divide it into the 4 quadrants going down through your belly button and across. Have your left upper quadrant, your right upper quadrant, left lower and right lower. First things I'm going to do is I'm going to auscultate your 4 quadrants for vowel sounds. Alright, vowel sounds are active in all 4 quadrants, so this is a good thing. Now I'm going to listen to your arteries with the Belloc stethoscope in your abdomen. First, I'll listen to your aortic up here. Then your renal on both sides. And then your iliac, which is down here right over your hip bone. Okay. Sounds good. Next, I'm going to percuss in all 4 quadrants. Sounds good. Next, I'm going to percuss your liver borders. So first, I'm going to start out going out from your umbilicus, your belly button, percussing until the sound changes. So, right there. Next, I'm going to start up here at your 4th intercostal space, right here. Percuss till the sound changes again. Right here. I'm going to measure it, and it should be between 2 and 4 inches. That's about normal. And you are at just under 3 inches, so perfect. Okay, last thing I'm going to do is I'm going to palpate. I'm going to support your back here with this hand. I'm going to get you inhale, and then when you exhale, I'm going to deeply palpate down here under your rib for your liver. Ready? Good. Don't feel anything. And then I'm going to do the same thing on the other side for your spleen. I'm going to have you inhale, and then exhale, and palpate. Good. I don't feel it, so that's a good thing. Okay. That's it for your abdomen. So now I'm going to have to do your neurological, so you can go ahead and sit up and you can put your gown back on. Okay, so first thing I'm going to make sure you are alert and oriented times 3. Okay. So I'm going to give you 3 words. I want you to tell them to me at the end of the assessment. Okay. Cat, dog, and tree. Okay. So to test your present memory, I'm going to ask you who the President of the United States is.
Barack Obama.
Yes. And what is your birthday?
April 30th, 1992.
Good. That's testing your past memory. Okay. Now I'm going to give you a scenario and you tell me what you would do.
Okay.
You found the envelope stamped on the ground. What would you do with it?
Probably take it to the post office.
Okay. Good. That's good judgment. Next, for abstract thinking, I'm going to give you a saying. I want you to tell me what it means.
Okay.
The early bird gets the worm.
I guess whoever wakes up early and gets together and works hard gets the food.
Yes. Good. And so, what were those 3 words that I gave you?
Cat, dog, and tree.
Yes. Good. Okay. So you are alert and oriented. Next thing I'm going to do is I'm going to test your cerebral functioning. We do 3 general, and I assessed your gait when you walked in, and you were walking fine. Okay. And then I did your balance when I did the Romberg test. Had you stand on 1 foot. Next thing I'm going to do is light touch. No, I'm not. I'm gonna do, I'm gonna have you walk heel to toe like this. And then you're gonna turn around and come back.
Okay.
Very good. Alright, now we're going to do your sensory function, which I'm going to do light touch and sharp and dull first. So I'm going to have you close your eyes and you tell me when you feel this touch.
No.
Alright, good. Now I'm going to do what's called sharp and dull, and I'm going to show you, close your eyes, and give me your hand. This is dull,
Okay.
and this is sharp.
Okay.
So you tell me which one it is.
Sharp.
Yeah.
Dull.
Uh-huh. Very good. Okay, now we're going to do 3 discriminatory tests.
Okay.
The first one we're going to do is called stereogenesis, and I'm going to put an object in your hand and you're going to tell me what it is.
Okay.
So we're going to do this here first.
Rubber band.
Yes. Awesome. We'll do the other hand.
Paperclip.
Yes. Good. Okay, and the next one we're going to do is called graphesthesia. I'm going to have you close your hand. I'm going to write a letter in this hand first and a number in that one. You're going to tell me what it is.
Okay.
Alright. So I'm going to write a letter.
A.
Yes.
4.
Yes. Last one we're going to do is your kinesthesia. I'm going to have you close your eyes. I'm going to move a joint and you're going to tell me which joint I'm moving.
Okay.
Alright.
Toe. Paper. Knee.
Alright, good job. That was your sensory functions.
Okay.
And the last thing we're going to do is I'm going to test your deep tendon reflexes.
Okay.
So first I'm going to do your upper arms, upper body. Have you relax. This is your tricep. Very good. I'm going to do your bicep. Okay. Do your tricep on this one. To the left. Very good. Do your bicep. Okay. We'll move the table over here. And we're going to do your brachioradialis. That's kind of hard. Okay, your other hand. Very good. Smashing. Okay, now I'm going to do your patella tendon in your knee. So just relax. Now we're going to do your Achilles. So I'm going to have you stay in the chair just like this. Okay. And relax your feet. Very good. Very good. Okay. You can sit back down on the bed. Last thing we're going to do is look at your musculoskeletal system. First, I'm going to just inspect your gait when you walked in, your posture, your sitting up great, and your joints. I'm going to palpate your joints here for size and symmetry, your shoulders, your elbows, your wrist, all your fingers, the pain, your knees, ankles, and your toes. And I'm going to palpate your muscles for the same thing, for symmetry and size. No pain when I'm doing this. Yeah, good. Okay. Now I'm going to have you stand up and bend over, and I'm going to inspect and palpate your spine to make sure it's midline. Feels good. Very good. Okay, and the 2 last things we're going to do are your range of motion. So I'm going to have you put your arms up, out to the side, in front, back down, and then keep crossing in front. Good. Okay, you can hop back up in bed. And then kind of have you kick your leg out, kick the other one, lift your legs up like this. Very good. Now I'm going to test your strength. So the upper body, I'm going to have you do like this. I'm going to have you push against my hands. Pull. Same thing here. Push. And pull. Very good. Okay. So I think that completes our exam for today. I'm going to list my cranial nerves now to tell you what tests I did for each of those. Okay, for the first one, it was your olfactory. I did the smell test. Number 2 was your optic, and that was the 2 vision tests, which the smell and I did at the beginning in year 2020. And the Rosenbaum was the nearsighted. And then 3, which is trochlear or oculomotor. 4 is trochlear, and 6 is abducens. Those all 3 tested your Pearl, your H test, and your visual fields. 5 was trigeminal, and that tested when I had you clench your teeth, and we could also touch that with something else. And then cranial nerve 7 was your facial. I had that tested whenever you were smiling and puffing your cheeks and frowning. And then 8 is your vestibulocochlear. We did that with the Romberg test, and it's also tested with your clear speech. And then number 9 was your glossopharyngeal. That was the taste test. 10 is your vagus, and that was tested with your uvula moving up and down when you swallowed and the gag reflex. 11 is your accessory, and we did that when you had your neck muscles and your shoulder shrug strength. Last one is 12, and that is your hypoglossal, and that was with your tongue strength and your tongue movement and sticking it out. Okay. All right, that completes our assessment. Okay.